جميلة الحقيقة. فأنا زي ما استمتعت جدا بالتوك بتاع الدكتورة داليا، الحقيقة نقلتنا نقلة جميلة جدا، وفي أسئلة كتير قوي يا دكتورة داليا بتدور في ذهننا دلوقتي. أنا برضو عارفة ومتأكدة إن رشا هتعمل عرض رائع للجميع. اتفضلي يا دكتورة رشا، هي هتكلمنا على البروفيلاكتيك ثيرابي اوف هيريديتري انجيوديما.
جزيل الشكر أستاذ دكتور إلهام وجميع أساتذة دكتورة شيرين دكتورة زينب، وشكر جزيل لزملائي. وإذا كنا بنعمل حاجة كويسة فده اللي اتعلمناه من حضراتكم، يعني وحضراتكم دايما قدوة لينا، ربنا يبارك في حضراتكم لينا يا رب. أنا هعمل شير سكرين. ماي توبيك عن البروفيلاكتيك تريتمنت ان هيريديتري انجيوديما، وانا هعمل ستريس على الهايلايتس فروم ذا اياكي كونجرس. هي الفكره في الهيريديتري انجيوديما، ولان البري كاليكرين سيستم والبرودكشن اوف براديكاينين هو ده المين باثوي اللي مسؤول عن الهيريديتري انجيوديما. فكان الاول في الدراجز اللي قبل كده كانت اللي هي زي السي 1 انهبيتور كونسنتريت والاندروجين والترانكزاميك اسيد هي المين بروفيلاكتيك تريتمنت. لكن كارنتلي دلوقتي بقى في عندنا اللاناديلوماب والبيروتروستات والبي اتش اي 022121 دول الدراجز النيو دراجز اللي بقى عليهم النيو ريسيرش كارنتلي. اللاناديلوماب ده سبكوتينيوس مونوكلونال انتي بودي تارجتنج البلازما كاليكرين. البيروترالستات ده اورال once daily selective plasma kallikrein inhibitor. الPHA 022121 ده still drug under investigation selective bradykinin beta 2 receptor antagonist. وكمان في هنتكلم عن الجين اديتنج كمان للKLKB1 جين اللي مسؤول عن الاكتيفيشن البري كاليكرين سيستم. انا هتكلم عن كل مجموعه دراج او كل دراج لوحده. الاول اللي قيل عن اللاناديلوماب في الاياكي كونجرس واتس نيو. الاول نعرف ان كان في حاجه اسمها الهيلب ستادي، ودي كانت راندمايزد دبل بلايندد بلاسيبو كنترول ستادي، ودي كانت اتكلمت عن ستادي الايفكت بتاع اللاناديلوماب ان ذا prophylaxis in hereditary angioedema وببلشت 2018 وانكلودed 125 patients with HAE and showed significant reduction in the attacks of HAE on using this prophylaxis. الجديد ان اتعمل الهيلب اوبن ليبل اكستنشن ستادي، ان الستادي was extended to follow up the patient up to 132 weeks and it included patients from the original study زائد كمان newly enrolled patients were included. and وكان زي ما احنا شايفين في الفيجر هنا ان في significant reduction في الاتاك ريت لما كانوا على اللاناديلوماب prophylactic treatment. في اللاناديلوماب هيلب اوبن ليبل اكستنشن ستادي ان البيشنتس were attack free for an average of 98% of the days after day 70. هم بيعتبروا الحكم بعد day 70 لان بعد day 70 بنوصل stable level of the drug in the body. 48% من البيشنتس experienced more than 6 months free of attacks و more than 70% of the patients had more than 12 months free of the attacks on using this prophylactic treatment. And in another study, in the same study, but in different analysis, it was found that in subgroups of the patients all have comparable reduction in the median attack rate, regardless of the type of hereditary angioedema, whether type 1 or type 2, the body mass index, the history of laryngeal attacks, and the long-term prophylaxis used that was used before the lanadelumab. And concerning the safety of lanadelumab, it was generally well tolerated. Treatment-related adverse events were about 55%, and 2.8% of the patients had to discontinue because the intolerable side effects. 1.4 had severe side effects, while 0 had serious side effects. And thus it was considered that lanadelumab effectively reduced the attack rates and was well tolerated over an extended period of time and across broad spectrum of the patients. What about down titration of lanadelumab in patients who were controlled? This was thought and this thinking was questioned, and to investigate this effect, lanadelumab was used, actually a license to be used every 2 weeks at dose of 300 milligrams. Some researchers thought about if we can decrease the dose in stable patients to every 4 weeks. And in this study, this was a virtual modeling-based approach in which this approach, the decreasing or the down titration of lanadelumab into 4 weekly dosing was studied, and it showed that although it still protected the patients, yet there could be a breakthrough attacks. So it's recommended better to keep the patients on the 2 weekly dosing regimen. The next drug is the berotralstat, which is also approved to be used in hereditary angioedema beyond the age of 12 years. And berotralstat, as we said, that it's a selective inhibitor of the kallikrein. It has been investigated through what's called the APEX study, which was a double-blinded placebo-controlled study, including 121 patients with HAE. A part of them were on the recommended dose, 150 milligrams, were 40 patients, and part were on 110 milligrams, and part were the placebo. They were followed up for a period of 24 weeks in the first part of the study, and later on for 48 weeks. And after 24 weeks of the follow-up, of the 40 patients who were on 150 milligram of berotralstat, 23 patients had more than 50% reduction in the HAE attack compared to their baseline levels, and 20 patients had more than 70% reduction in the HAE attacks, with a significant decrease in the requirement of the rescue medications. And concerning the side effects, berotralstat was also well generally tolerated, and the common side effects included some upper respiratory tract symptoms, some gastrointestinal symptoms, and headache, and actually 90% of them did not require specific treatment. So berotralstat was also an effective treatment option that can improve the hereditary angioedema disease burden as a prophylactic treatment. And here there is an extension of the APEX-2 study. In this extension, the patient were further followed up to 96 weeks of treatment, mounting up to a total duration of 2 years. And we can see here that there was also significant reduction in the hereditary angioedema attack rate with the continued treatment of berotralstat through the 24 months of follow-up, and meaning that this drug is also could be a durable and effective option for hereditary angioedema prophylaxis. What about impact of COVID pandemic on the efficacy of hereditary angioedema prophylaxis? COVID pandemic is a stressful condition, whether socially, physically, and psychologically, and it's expected to trigger the attacks of hereditary angioedema. And it was found on this analysis that the assessment of the hereditary angioedema attacks pre-COVID and their comparison during the COVID pandemic, while in patients were on berotralstat, they had the same consistent low hereditary angioedema attack rate, meaning that this drug maintained a low attack rate during times of stress. Another drug that's under investigation is the PHA-0221 drug. This is a selective bradykinin beta-2 receptor antagonist, not yet approved. It's still under development and investigation. It's have been studied first as a treatment, not as a prophylaxis. And in this study, Groen et al. Decided to investigate whether the pharmacokinetics and safety profile of the continued use of this drug allow it to be used as a prophylactic treatment. So 38 volunteers of patients were put on this drug with rising doses from 12 up to 50 milligram twice daily, and safety and pharmacokinetics were assessed. And it was found that the repeated oral dosing of this drug in doses up to 50 milligram per day was well tolerated, with some side effects like gastrointestinal or neurological, like headache, or some respiratory manifestations that usually are dose proportional. And the dosing regimen maintained the plasma trough levels at a steady state, and the data support further clinical development of this drug as a prophylactic treatment, although further and much more data are still required due to the low number of patients investigated and the short duration of follow-up, only for 10 days in this study. All mentioned the prophylactic treatment are required long lifetime, and now patients are asking, is there any hope for cure? Now we are talking about the genome editing, and we are in the era of the genome editing. And here we mean by genome editing, we are not going to tackle the pathway of the C1 esterase inhibitor. Instead, and as the prekallikrein is the main pathway with the production of bradykinin, they aimed to target the KLKB1 gene through a CRISPR-Cas9 based therapy targeting using what's the drug called NTLA-2002. This is a new drug still under development, very early in the very early studies, It has been tried in the humanized mouse model and in monkey models, showing a gene editing of nearly 70% and decrease in total plasma kallikrein around more than 90% in a humanized mouse model, and more than 95% decreased plasma protein kallikrein and activity in the mouse model, in the monkey models. And these effects were maintained for up to 20 months of treatment, which are encouraging results, and thus supporting further development of NTLA-2002 as a potential single course treatment option for the patients with hereditary angioedema. It's not counted among the prophylaxis, it's rather counted among the possibility of a curative treatment. And finally, I would like to thank my dear professors for their interim support, especially Professor Irham in the preparation of our slides, and thanking for Professor Zainab and Professor Shireen for support and guidance all the time. Thanking my colleagues, Dr. Dalia, of course, my close colleague, and all my friends and sisters, the young generation. And may Allah bless the soul of our professor and the role model and our mentor, Professor Yahya Al-Gamal, and to whom we grant what we have reached now, and the one who have founded the unit, the society, and the journal. May Allah bless his soul. Thank you.
Thank you very much رشا. بنشكرك العرض الرائع اللي قدمتيه الحقيقة، يعني outstanding بصراحة.